All right, everyone. Welcome to week 9 of general psychology. Now, I have to tell you, this is my absolute most favorite part of learning about psychology, learning about abnormal psych and mental health disorders, which is this week's topic. So I will be very excited and giddy, and I could literally talk for years about this topic. However, this is a very short PowerPoint, so I will try to cram it all in. Here's a quick little overview of abnormal psych. And BTW, I put a lot of really cool videos in this week's supplemental videos because I wanted to show examples of things like schizophrenia and dissociative identity disorder, which is multiple personality disorder, and a whole lot of bipolar type things. So really, if you're as morbid as I am and you are interested in that kind of thing, please check out this week's supplemental videos. Alrighty. Abnormal behavior is distinguished from normal behavior with these 4 criteria. There is the statistical infrequency of doing something less than others or doing something that others don't normally. Then there is the violation of social norms, and that is basically saying that the behavior is not acceptable normally. So this is super culturally driven because some behaviors are okay in one place and not in another place. Personal distress, which is focusing on whether a behavior causes personal issues or suffering, and then the level of impairment, which is judging the extent to which a behavior interferes with an individual's ability to function or causing distress to yourself or others. Look at this, the very first note card of the day. Abnormal behavior. And on the back side, violation of social norms and very culturally driven. All right, explaining psychological disorders. There are biological theories, which is the medical model. Psychological theories, so that is basically abnormal behaviors attributed to internal or external causes. And sociocultural theories. So that could be things like age, gender, socioeconomic status, etc. And obviously the important one is the one that is bold and underlined here, the biological theories, because that is when psychological issues are treated like medical problems, which they are. And then there is the biopsychosocial model. So that's integrating all of those things. And probably that's, for at least a few of these disorders, that's probably the most likely culprit. All right, next note card. See, this goes really fast. I could talk forever about this. Biological theories. And on the back side, psychological issues are treated like medical problems. And that also means that we can usually prescribe drugs to fix said problems. All right. Oh, my dear friend, anxiety. So, anxiety includes a lot of physical symptoms like dizziness, lightheadedness, sweating, racing heart, increased blood pressure, etc. So basically, your sympathetic nervous system is activated when it doesn't need to be activated. So the cognitive components are thoughts that are unrealistic or at least disproportionate to the situation, such as worrying excessively, fearing a loss of control, dangerous situation perception, paranoia. That's all from your amygdala. Remember that from a couple chapters ago. Your amygdala is kind of your fear brain, your lizard brain that does the primal emotion of the fight or flight. Emotional responses may follow and might include panic, irritability, restlessness, things like that. So here are some examples of anxiety disorder. There's GAD, or generalized anxiety disorder. So that is like over a period of 6 months, you are typically worried about multiple things, and they can't necessarily treat each individual thing, or at least can't pull each thread of the mass of worry to treat each individual thing, so they just classify it as general anxiety disorder. Next, there is panic disorder. So that is obviously associated with panic attacks. It's the anxiety and fear without stimulus, and I think that's very important to note that they come on for no reason. They are very intense, and then they leave just as fast as they came on. Then we've got phobias, which are very intense, irrational fears. That's a very important word, I think, irrational. You cannot rationalize your way out of a phobia, a true phobia. So if you have arachnophobia and you are truly terrified of spiders, there's really no way to be like, hey, but these guys are just like tiny little creatures with 8 legs. There's no rationalizing yourself out of a phobia. And then we have my not so good friend, OCD. So OCD is pretty misunderstood because I think people just think of it as, you know, needing things to be very clean or needing to wash your hands a lot. It's usually like germaphobes or things like that. But OCD, there are actually 8 types of OCD. It is just a pattern of unwanted, intrusive thoughts and the urge to do repetitive action. And you have to do that repetitive action in order to get rid of the anxiety that is causing you intense uncomfortability. So there is like hoarding is an OCD. There's harm OCD, where you have unwanted intrusive thoughts about harming yourself or others. There is the I wish I knew the technical name for this one right now, but it's just like, I always call it the light switch one, where you have to constantly check like if the light is off or on or off or on. And then there's the one where you have like certain numbers that you have to complete an activity to a certain number, or else, you know, you think something bad's gonna happen. I think OCD is one of the worst mental disorders that anyone could ever have, and treatment for it is not easy. Then we have PTSD. So PTSD has a ton of different symptoms, and they can pop up at several different times, and they can be completely debilitating, or they could just, you know, warrant one panic attack and then it's gone. So PTSD is one of those like it's very complex and not one size fits all. All right, then we've got the other side of things. So we just talked about anxiety and like speeding up your brain and like your brain working overtime. And now we're going to talk about mood disorders like depression. So, major depression is obviously a very common mood disorder. So that's sadness or apathy for an extended period of time. So it's not just like, oh, my dog died, I'm so sad. This is sadness for no apparent reason, or apathy, and I think that's a big one. Apathy is the feeling of not caring, right? So things that used to make you happy or used to bring you joy no longer do. You're not motivated anymore to do things, and you kind of can just waste away that way and feel like you could waste away that way. There is dysthmic disorder, which is the same basically as major depression. It just is a little bit less intense, but it lasts a long time. Then bipolar, which used to be called manic depression. So bipolar is kind of the worst of both worlds, I guess. You get days of total mania where you have like the best mood you've ever had. You get that euphoria. You have tons of energy. You're creative. You're funny. You're amazing. And then, bam, like a light switch, you can be one of the most depressed, sad, tired, suicidal people that has ever existed. So bipolar is a very scary disorder. And then there is the cyclothymic disorder, which is the same as bipolar, but less severe, and it lasts longer for those lucky people. So, like I said before, the most common mental disorder is depression, and especially true in the elderly. And think about it. As we age, I mean, what are we aging for? We're getting older just to die. So knowing that everything that you've worked so hard for in your life is coming to an end, obviously you would be very depressed towards the end of that. The suicide rate in the elderly is very high. There's so many changes with constantly being diagnosed with things. Your body doesn't work like it used to, so you can't move like you used to. You can't work like you used to. Your friends are dying. You know, have to move away from your family so you can get, treated or things like that. So it's very underreported, I think. People don't pay enough attention to the suicide rate in elderly people. All right. So again, major depression is extreme sadness, extreme apathy for a long period of time. Now, the dysthmic disorder is not as extreme, but it's definitely more chronic, so it lasts longer. And it goes from, major depression says lasts for at least 2 weeks, and then it goes to lasting to at least 2 years. Alrighty, note card time. Mood disorders. And on the back side, major depression, extreme sadness, apathy for at least 2 weeks. Bipolar, shift in mood between depression and mania. So those are the two big ones. Here's a little bit more about bipolar. So it typically comes on in late adolescence and early adulthood, so in your late teens, early 20s. And again, the two moods are, depression, total major depression to total extreme euphoria. Okay, another goodie, but baddie. Schizophrenic disorders. So there are so many types of schizophrenia, and actually now they kind of classify it on a spectrum because there are so many different types and so many different degrees of schizophrenia, and all of them affect many different parts of the brain, and like no two, versions of schizophrenia are the same. So we're not going to go over all of it. We're just going to go over some generalized things. So it's a severe disorder characterized by disturbances in thought, perception, emotions, and behavior. So this version is pretty common in the elderly. However, a lot of times it can be confused with Alzheimer's or dementia. Thought disorder, which is a lack of connection between thoughts and ideas. It's like having word salad, so kind of like listening to me talk sometimes. But it's basically not being able to connect your words to any one thought. It's like ADHD to the extreme, where you're talking about one thing and before you can finish that sentence, you're talking about something else. And then there are delusions. So delusions are, things that aren't true, but the affected person believes it to their core. And again, this is irrational, so it's not like you could talk them out of believing it. If the person thinks that they are, the next Messiah, you can't just point to, a Bible and read it to them and try to reason them out of it. They believe to their core that that is who they are. A lot of schizophrenic people tend to lean towards the paranoid, so they might think they're being watched or being spied on. And again, there's no talking them out. It is 100% who they are. Then you've got your hallucinations. Good times. So that's, seeing something that's not really there. So you either see people, you can hear voices, you can see spiders, just all sorts of scariness. Then you've got the disordered affect, which is also on the autism spectrum, but basically it's having a flat, stoic affect. So you're not showing any emotion at all in your voice, in your face, in your body movements, nothing. It's just flat. And then on top of all that, you've got your disordered motor behavior. So that is any unusual or odd or repetitive behaviors or gestures. Or it could be an absence of all motor behavior. So that's like being catatonic. And then there could also be sudden agitation and activity, which is known as catatonic excitement. This one's so interesting, and I would love to teach an entire class just on DID. So, dissociative disorders are marked by a loss of awareness of yourself, basically. So, they there is something called a dissociative fugue, which is episodes of amnesia where you cannot recall some or all of your past and you don't know who you are. And then we have DID, which is dissociative identity disorder, and that is what used to be known as multiple personality disorder. So I don't know if you guys have seen Sybil was the big one when I was growing up, and now they've got, what's the name of that one? Switch with James McAvoy, where he plays a bunch of different characters. But basically, it is your brain splitting from reality by giving you multiple different identities to coexist with your true self to protect you from whatever it is, from some horrible trauma. So it's like PTSD to the extreme, and it often happens when someone is very young and cannot deal with the horrible traumas that happen to them. They, end up creating different identities unconsciously to kind of serve as their protection and kind of help them deal with it. All right, note card time. Dissociative disorders. And on the back side, dissociative fugue and dissociative identity disorder or multiple personality disorder. And here's another kind of mental illness that is really mental illness about illness. So these are somatoform disorders. So these are people that are, well, we know it as hypochondriacs. Those are people that believe they have an illness, but there's really no physical reason for them to think that. They are just convinced that they have this illness. There's also a version of that where if the person themselves can't have the illness, then they want their offspring to have an illness. So that's known as Munchausen's by proxy. So that's if, somebody pretends like their child is sick or believes that their child is sick, and makes them sick in order to get treatment and attention. There's also body dysmorphic disorder, which is very prevalent right now, especially among adolescents. That could be something like anorexia, bulimia, things like that, or it could be the kind of gender disorders that are happening more and more, and basically it's any preoccupation or obsession with your body and believing that it's defective. Then there is conversion disorder, and basically what that is that your brain has convinced your body that you have something wrong. So your body is physically showing some sort of a symptom or disorder, but there's no bacteria or virus or any reason that you should have that. So basically your brain is tricking your body into being sick. And then there is somatization disorder, which is a long history of physical complaints with no apparent cause. So if you ever watched the show House, that's always, I always think of that because they always think that their patient has conversion or somatization disorders, and that's usually like their very first diagnosis. All right, here is the lovely Florence Nightingale, a famous hypochondriac. She was also a famous nurse. So the Nightingale Pledge, taken by new nurses, is named after good old Florence here, and her International Nurses Day is celebrated on her birthday. So what makes this important is that she spent the majority of her life in bed, convinced that she was suffering from several different illnesses, such as headaches and heart disease, and she always felt on the verge of death. So she died when she was 90, so clearly she was pretty dang healthy. But she also was bedridden for 57 years. Alrighty, now we're going to talk about some personality disorders. So this is different from the mood disorders or the biological disorders. So these are things like psychopathy and antisocial disorder. So we know of antisocial personality disorder, which is, people that disregard other people's rights and they have no remorse and no guilt. So that is like being a psychopath or being a sociopath, is kind of that absolute lack of empathy, and really just kind of no real emotions at all, just a lot of pretend emotions for them. Then you've got borderline personality disorder, which is pretty common, and that's usually, you can tell because there's unstable moods, have a hard time with relationships, hard time with self-image, and I love that it says consistently inconsistent, because that's true. Once you think you've got it figured out, you don't have it figured out. All right, that was abnormal psych in 20 slides. And seriously, I could really talk about it for like the rest of the year. So if you have any weird questions, ask me, because I love talking about this stuff and I love learning about this stuff. So I would be happy to answer any strange questions for you. And have a good night.